started today. My name is Ashley Brandt Duda, and I am a partner in our healthcare services area, primarily specialize in providing assurance audit type services to our healthcare clients. And I'm joined here today by Jason Adams, who is a senior manager in our healthcare consulting area. And I'll let Jason speak to this as well, but Jason provides a variety of services, reimbursement, some audit. I think we still pull him in sometimes as well. So a lot of different areas of experience with Jason. Okay, and so before we get started, we'll just get started talking about some general provider relief funding terms and conditions, and then walk through some of the different considerations surrounding tracking these different funds that you've all received. And I thought about this after putting the presentation together, is that we should have really had a slide probably in huge, bold, red letters, just saying that all of the information that we are talking about is really information that is effective as of today, which is June 18th, for those of you that might be watching this on video later. It's been very interesting, as I'm sure you've seen as well, as information has been released, and then more information is released and more guidance. And quite honestly, even up until this week, we were bugging poor Amy by making her make changes to our slides as more information and more questions were answered by HHS. So as we walk through things today, again, we're going with the information that is out there at the time and providing our best guidance on that. But please remember, this is a changing situation, and just to really keep in mind as you're moving forward, as you hear additional information to come out, to be observant of that as well. And so first off, just talking about the provider relief funding and some of the terms and conditions. So there's general terms and conditions that are relevant for the majority of the provider relief funding. So this covers the initial $50 billion general distribution that most of you would have received if you do receive Medicare payments, and then also several of the subsequent targeted distributions. And so the ones that are not included here would be any of them related to the rural RHC testing, or if you received any funds under the FFCRA relief fund payments for the testing. Those are slightly different, but for the most part, this slide here is really encompassing the majority of the funds that you would have received. And so just a few important points that we wanted to point out from the terms and conditions. And the first one is that the recipient certifies that the payment will only be used to prevent, prepare for, and respond to coronavirus, and that the payment shall reimburse the recipient only for healthcare related expenses or lost revenues that are attributable to coronavirus. And so just a really important part of that, of course, and where a lot of the questions are coming up, is that that's pretty vague, is, okay, well, what exactly does this mean by lost revenue? And also just those expenses, you know, what exactly are we looking at there? So that's some of the things that we will be talking about today and expanding on. A second item there is that that you have to certify as a recipient that you will not use the payment to reimburse expenses or losses that have been reimbursed from other sources, or that other sources are obligated to reimburse. And so important part here is they don't want you double dipping on any of the funds. And so the big one, of course, that we are hearing and seeing out there right now is the PPP program, as I'm sure a lot of you did receive loan proceeds under PPP. So as you're working through this process, just remember that if you have any expenses that are covered under PPP that you are expecting you will have forgiven, you will not want to also utilize the provider relief funding for those as well. And then also the recipient shall submit reports as the secretary deems are needed to ensure compliance with conditions that are imposed on the payment, and such reports shall be in such form with such content as specified by the secretary in future program instructions directed to all recipients. And yes, that's a mouthful. But I think the big thing here is they are pretty much adding the disclaimer that, okay, we are going to want information from you and we will need reporting, but it's really, I think, open at this point as to what exactly that looks like. And one of the things that we'll cover further in the presentation as well is the reporting and some of the clarifications that have come out since the terms and conditions were released on what some of that reporting, potentially the timelines of that. And then, as I mentioned, so the rural testing, so if you have RHCs and receive this, I did not do a separate slide for the FFCRA, although that one is similar. But basically under the rural testing, very similar, so I won't go through the whole thing, but it really just comes down to this first point is really what's different. And that is if you receive the funds under the rural testing RHC portion, is that you have to certify that the payment will only be used to reimburse the recipient for COVID-19 testing and the COVID-19 related expenses. So this one here, the lost revenue piece is not included. And that would be the same with if you did receive the FFCRA, except that one actually goes a step further and that it has to be testing and services for the FFCRA uninsured individuals. So keep that in mind if you did receive some portions from that, just as you're working through to make sure that you're looking at those funds separately and making sure that you're attributing or that you're following the terms and conditions and attributing the right amounts to the right funds. Okay, and so the big question out there, okay, we received this money. Is there a potential that these funds will be taken back by HHS? And so there was information released back on May 5th. And what was said at that time was that generally HHS does not intend to recoup the funds as long as a provider's lost revenue and increased expenses exceed the amount of provider relief funding that the provider has received. And so they actually took that a step further. Actually, again, not in the slide because this just happened a few days ago here, is that for targeted distributions, so those distributions that were outside of that original $50 billion general distribution, they actually went as far as in an FAQ to say, with a targeted distribution, if you even received more funds than you should have received, is that as long as you have that lost revenue and the expense to cover it, that you can keep those funds and utilize them. So I think that was an interesting point. They specifically mentioned the targeted distributions. They did not mention the general, so we have no guidance on that at this point, but I just thought that was very interesting that not only are they saying they likely won't recoup them, that they're saying, okay, even if we gave you too much, if you use it for the right purpose, we won't recoup that either on the targeted distribution side. That being said, again, always the disclaimer here in point 2 is that they do say HHS reserves the right to recoup all or a portion of the funds if paid in error or if you were not eligible to receive them. So I think they're definitely covering their bases here of that likely not expected to happen, but they are definitely reserving the right to do so. The third point here is that HHS reserves the right to audit any of the relief fund recipients in the future to ensure that all the requirements are being met and that they can collect again any amounts that were received or paid in error. And so along the lines of auditing, I think there's some uncertainty out there of exactly what this will look like. I think every organization should assume, regardless of the amount that they receive, that they could potentially be audited at any time. There was actually some guidance that just came out, I believe, 2 days ago from the Government Audit Quality Center. And essentially they have verified what we were thinking, and that is that if you are a nonprofit organization and you expend more than $750,000 of between these type of funds and any other federal funds that you receive, if you expend more than $750,000 of these funds within your fiscal year, you will be subject to a federal single audit. So you may have had those in the past if you receive other grant funding, but they have clarified that these will be subject to federal single audit. And so assuming that you expend over that $750,000, that is something that you will have to work with your audit firm on because you will likely be subject to that type of audit. One thing to keep in mind, PPP funds are not expected to be included. So if you have PPP funds that you received, you don't need to include those in that calculation of the $750,000. They've also said that there will likely be some type of audit requirement for for-profit organizations, but there's nothing that has really been released. So that's really still out in the open. Again, definitely something just to prepare yourself for and make sure that you're adequately covered documentation-wise. Okay, so getting into the nitty-gritty of what are some considerations for tracking the funds? That's the big question. So we received a lot of questions of, okay, I have these funds. Do I need to put them in a separate bank account? How do I best do this? You certainly can. You can isolate them in a separate bank account if that's really the easiest way to do it. We're also seeing a lot of organizations that are tracking them through separate GL accounts. That seems to be a pretty common method. And further along in the presentation, Jason will touch on the tracking through general ledger accounts, and if you do go that route, some considerations that you should take. But I think really the key here is making sure that you have some way of tracking it, because this is going to be very important as you move ahead, not only if you're experiencing an audit, but also just for reporting purposes. Next step is to take a look and identify lost revenues that you have that are attributable to coronavirus. Again, that's something we'll talk a bit more about here in our presentation, but this is an interesting one because there's not necessarily a well-defined way to do this, and there's a lot of different factors that can be in place as far as lost revenue goes. Next, you want to identify any incremental expenditures that are required due to coronavirus. So that would be any items that you previously would not have had before, but now because of the pandemic, you've now experienced an increase in costs. Again, Jason is going to be covering some of those as we move forward on the expense side. Ensure no double dipping. I mentioned this already, but this is very, very important, is that there's a lot of different funds out there, and so just really tracking what you're doing and making sure that you are not utilizing the same expenses for different programs, because that's going to be a very important point, that it's in numerous places in the terms and conditions, in the question, frequently asked questions, so definitely seems like something that is going to be a focus. Once you worked through, okay, I've tracked all of this and I know what my expenses or my lost revenues are that I'm attributing, you can then release the amounts and consider those amounts spent. So again, just keeping track of that, keeping track of also which bucket it is within, if you've received several different types of HHS funding or PPP or whatever it might be. Again, just releasing them out of those buckets as you spend them. And then retaining the documentation for future required reporting and potential future audits. There's likely going to be something, we maybe don't know exactly what it looks like, but you will at some point be required to report on these. So just really making sure that you have your documentation in place. Okay, so lost revenues. So as I mentioned, this is a very interesting one because there's many different ways that you can look at lost revenues. And so there's a little bit of confusion with this, because I know some of you might be saying, well, I already reported my lost revenues. So if you received the second round of the general distribution payment, you were required to submit an overall estimate of your lost revenues for March and April. And so that was really just more of a high-level estimate that you were required to report as part of that process. But this is really more so above and beyond that, and really tracking your lost revenues, not only for those periods, but for subsequent periods as well as you move forward. And so there's a few different ways that you can look at the lost revenues. The example that was given for the previous reporting that HHS gave is they said, okay, it'd be adequate to do a comparison to budget, perhaps a comparison to prior year. But I think there's also just a lot of different considerations around this, because oftentimes a comparison to prior year or a comparison to budget is not necessarily your most accurate representation of what your lost revenues truly are. So some other things that we've looked at and that we've built into some of the modeling that we do, that again, Jason will run through with you, is we've said, okay, in addition to budget and prior year, what are the average historical results based on the month that you're in, trends, how things are moving forward? Also forecasted results, because as we all know, things tend to increase inflationary over time. So rather than just comparing to last year, what is a true forecasted amount that we really expected that we would have received if it wasn't for the coronavirus? So other interesting part of the lost revenues is that, so when the terms and conditions first came out, they said, okay, it's lost revenues and it's expenses. But HHS actually did come out with a frequently asked question just on June 2nd, where essentially what they've said is they've clarified this concept to say that providers can use Provider Relief Fund payments to cover any costs that the lost revenue otherwise would have covered, so long as the cost prevents, prepares for, and responds to coronavirus, or responds to coronavirus, excuse me. And then they also said that they're encouraging the use of these funds to cover lost revenue so that providers can respond to the coronavirus public health emergency by maintaining healthcare delivery capacity. And so through this, and again, it's still a bit vague, leaves a bit of interpretation out there, but they're really seeming to, a couple of things really I think come to mind with what they're trying to say here is that the first one is that likely you're not just going to be able to say, I lost $1 million of revenue, and so here's this $1 million. So I'm now assuming that that's okay. It really does seem that they are going to want you to specifically identify and show that, okay, we lost $1 million, but what expenses did we cover with that $1 million that really we would have used that $1 million for before? One thing to keep in mind though, and I think this is what's really emphasized in the second point, is this seems to be a different concept than the concept of the incremental expenses related to COVID that we will talk about in a few slides. Because really here, I think the key point is that maintaining healthcare delivery capacity. And so they're really wanting you to use this, it seems like, for more broad expenses that essentially you would have utilized that lost revenue for. And so I didn't actually put them in the presentation, but some of the examples that they actually used of expenses that you could cover lost revenue with is they said employer contractor payroll, employee health insurance, rent or mortgage payments, which I thought was very interesting because we don't think of mortgage payments in the expense category, but they put rent or mortgage payments in there. Also equipment lease payments and EHR licensing fees. So they said that was not meant to be an exclusive list. I think just something to get everyone thinking, but again, just a bit different concept than the other expense concept. But this is something that we will be monitoring very closely and just seeing what additional guidance comes out in this area. So for lost revenues, I think the big key is to really start this process now and start coming up with some methodologies and looking at, how does it really make the most sense for our organization to track this? Because it really is unfortunately not as easy as just saying, what was last April, what is this April? Because there's also factors in there such as if you had a service line that you discontinued, so you don't have revenue for that. Well, that's not lost revenue because of COVID-19. So again, I think just to really start working through that process and working through some of the methodologies, because I think once you do that, you might see that it's interesting to see how some of the different methodologies look, and there might be some that might make more sense and might be more beneficial to your organization. And then also the last bullet point, monitor guidance for potential cost report implications. And I know this is the big question. I actually got very excited because there was an FAQ that was released on this, and I thought, oh, great. And the answer was that CMS will be releasing more information on this topic. So didn't really give us an answer, but I guess at least they're getting asked it enough that they wanted to show that, yes, this is a frequently asked question. We know it's out there. But obviously, especially if you're a critical access hospital, this could have some significant implications as well. So again, something that we're watching and monitoring very closely. Okay, and so now I am going to turn it over to Jason. And so he is just going to give you a bit of an update on a tool that we are utilizing to help our clients work through some of these lost revenue considerations.
All right, thank you, Ashley, and welcome to everyone that was able to join the webinar today. I see one of those people for the chat is my mother, so hi, Mom. As Ashley mentioned, my name is Jason Adams, and I'm a senior manager in our healthcare consulting group. Like a lot of us right now, I'm working from my home office in Dubuque, Iowa. I look forward to getting back to our actual Dubuque office at some point in the near future, though. Also, as Ashley mentioned, it is important to develop a strategy around tracking these expenses and lost revenues now. It's important to get all that information gathered and ready for whenever HHS does come asking for that information. Currently, HHS has not provided guidance regarding one specific way to approach determining lost revenue. So we here at Eide Bailly have developed a tool to help set a baseline of historical revenue activity and project lost revenues in various ways mentioned by Ashley before. This slide is the summary tab of that tool. It shows you your actual gross and net revenues by month and compared to expected net revenues and summarizes those totals at the top of the worksheet. So this particular file here at the top, you can see the lost revenue total of $297,000 for the months of March and April. And then you'll continue to populate data in here as the months go. There is a drop-down box at the top of the worksheet. My mouse over here. So you can see right now this is set at the forecast option. You can drop this down to pick either the budgeted option, the adjusted option, the average prior year option, or the forecasted option. And this information is pulled over into this summary tab from the various other tabs that you can see here at the bottom, the total, inpatient, outpatient, clinic, source tabs. The forecasted method utilizes historical financial trends and daily revenue per month to predict future revenue using linear regression and exponential smoothing. The budgeted option compares your actual activity to your budgeted activity, which I'm sure most of you have done already. Then we have the adjusted average option. This utilizes prior year's relevant months information as a baseline. And then it provides the ability for management to adjust at a service level. So at your inpatient, outpatient, clinic, long-term care level, you can adjust the gross revenues and deductions. So your adjustments to revenue based on certain percentages. So you can adjust those to reflect known differences in the current year versus the prior year. And finally, the last option is your average prior year option. You can use this. It'll just look at your average historical monthly information from the prior year and project that out going forward. And then we also have, there's a graph here at the bottom that shows that same information. The gray area is your actual net revenues, and then the blue area is the revenues that your lost revenue. So anything that's under what was expected based on what the form of expectation that you used. Oops, sorry, went too fast there. So the next slide is the total tab of this lost revenue tool. It shows your estimated gross and net revenues by month for all 4 options in total. The model provides you similar information to this tab and the different by service line tabs. So you see your inpatient, outpatient, clinic, and long-term care. The standard model is set up for these 4 different service lines. But it can be adjusted to meet the needs of any of your facilities. The graph at the bottom of the worksheet here provides a summarized comparison of the 4 different options in one place, sets a historical baseline of your actual, and then projects out the different forms of expectation going forward. So right here in this example, you can see that the adjusted option provides you with the most lost revenue. Most of the times we have seen that projected model is the one that shows us the most lost revenue, or the forecasted option, but in this situation, it was the budgeted one. So on a month-to-month basis, you will simply, export your monthly income statements from your financial system and drop them into what we have over here as the source tab. So it's basically just a copy and paste, if you can get that in Excel out of your system, dropping it down to the source tab, and then the model will do the rest of the work for you. It'll pull everything in. So it should be noted that each facility, it's going to be up to them to determine the option that provides the most realistic and reasonable amount of lost revenues, and then you'll want to document your rationale for using that method. So I recommend, or I ask that if you think it's necessary, to reach out to your trusted business advisors to talk through your revenue loss further. All right, let's move on to the expense side of things. In the most recent FAQ released by HHS, they identified examples of expenses related to COVID-19. And those expenses include your supplies and equipment used to provide healthcare services for possible or actual COVID-19 patients, developing and staffing emergency room operation centers, reporting COVID-19 test results to federal, state, or local governments, building or constructing temporary structures to expand capacity for COVID-19 patient care, or to provide healthcare services to non-COVID-19 patients in a separate area from where COVID-19 patients are being treated, and acquiring additional resources including facilities, equipment, supplies, healthcare practices, staffing, and technology to expand or preserve care delivery. Now that's a pretty broad set of expenses there. So the next few slides will cover some specific examples of these expenses. So labor costs will be one of the most significant costs incurred for most people. You'll most likely have many individuals throughout the facility involved in various COVID-19 related activities. Don't restrict yourself to thinking only about those labor costs directly related to caring for COVID-19 patients. You will most likely have a lot of other labor costs, things related to visitors and staff screening before individuals can enter the facility, security. We'll touch on a few of these later, but yeah, don't focus just on the cost of actually caring for COVID-19 patients. Think about the significant amount of time your facilities spend planning, setting up security measures, and outlining various policies related to COVID-19. You want to make sure you capture these costs as well. In addition, facilities will need to consider cost of furloughing staff and any hazard or quarantine pay provided to staff. If you have new staff that are brought on to help cover the COVID-19 efforts, it was probably necessary to bring them up to speed with training, education, orientation. I'm sure your facility also incurred education, training costs specifically related to COVID-19 policy and procedure changes. This was probably incurred for all staff, whether or not they were new or have been there for a while. So make sure you're including any of those training and education costs that you incurred. This slide covers examples of various supplies and transportation costs that could be incurred related to COVID-19. This list includes PPE, cleaning, sanitizing equipment as well, equipment and supplies for testing and screening for COVID-19, devices such as ventilators specifically for the care of COVID-19 patients. If it was necessary to set up alternative care sites such as tents in the parking lot or other temporary units, you'll need to consider not only the cost of those structures, but also the support costs things such as signage, directing patients where to go, what to do before they enter the building or the temporary sites, lighting for those temporary sites, additional utilities that you might have incurred for those different temporary sites. The list goes on and on. And also keep in mind the transportation cost of supplies and personnel from one place to the other related to COVID-19 issues. As mentioned earlier, COVID-19 brought about the need for new policies and procedures. These changes include the need for additional sanitizing and increased security around your facility. Whether your facility utilized current staff or outside contracted services for these duties, you'll want to make sure you capture these costs. This includes not only personnel costs, but also the supplies costs surrounding the sanitation or the additional cleaning. I hear the term deep clean used a lot. So any of those costs, make sure you're capturing those. All right, information technology. Telehealth services really continue to gain traction here as a response to COVID-19. So any costs related to the modification or the addition of new software or new hardware to utilize telehealth, make sure you're considering those when you're tracking your expenses as well. Like I said earlier, I'm working from home right now. So, any additional cost that you incurred to make it easier or make it happen for your staff to work from home, consider those. Cost of screening and tracking staff and visitors in and out of the facility, that, if there's any technology costs involved in that, make sure you're including those. Capital construction cost. We discussed temporary units earlier, but this is another reminder to include any construction or rental costs related to the temporary structures, or really any construction or cost that you incurred within the facility to to spread things out, give people more room, the social distancing. So there's a lot of construction that could be done within the facility itself that could be COVID-19 related. Things to adjust airflow or traffic flow, a lot of different things there that you can consider. Maybe it was necessary for you to purchase additional beds or make modifications to your current beds to help with the treatment of COVID-19 patients. All these costs should be captured in your acceptable expenses. So here's some other costs to consider. You should consider housing and childcare for quarantined and or working staff. I've heard where some staff just didn't feel comfortable going home to their families and loved ones after, working at the hospital or working at the facility. So it may have been necessary to provide that temporary housing or hotel rooms for these employees. It also may have been necessary to provide or cover childcare expenses for these employees during their extended shifts if they had no other alternative. And just a few other ones to consider: insurance, interest, and research. Research including any professional advice that you reach out and seek related to COVID-19. These are all costs incurred by your facility related to this pandemic. So make sure you're considering all of those. And please keep in mind that this is not an exhaustive list by any means. There are many other costs that can be considered when tracking your expenditures related to COVID-19. So we just wanted to get here in the list a good amount of those that you can use to cover these funds. Another thing I wanted to point out here is the relief funds cannot be used to pay the salary of any individual at a rate in excess of executive level 2 pay. So this would be $197,300. And as Ashley mentioned earlier, HHS has not really provided any specific guidance surrounding the treatment of provider relief funds on the cost reports. I saw that same FAQ that Ashley mentioned earlier and kind of got excited about it as well, but it didn't provide us with much more information. So we have reached out to CMS and we are awaiting a response regarding the treatment of these funds on the cost report, but we have not yet received a definitive answer. However, I do think it is important to understand that if CMS indicates these HHS funds need to be offset on your cost report, it could have a significant impact on your cost-based reimbursement. So I think it would be a wise business decision to at least understand the potential impacts of these offsets, because they could have a significant impact on your cost report settlements, especially for the critical access hospitals, rural health clinics, cost-based reimbursed entities. All right, so now that we've covered a variety of the options that should be considered when tracking the COVID-19 related expenses, let's discuss how these expenses should be recorded. It will be very important for cost reporting purposes to continue to code these expenses in the department where the service is provided. So doing this will help us match revenues and expenses on your cost report. There are probably many instances where an employee has been reassigned to help in different departments that's not their home department. So when something like that happens, it will be important to make sure those labor costs transfer over to that department too. So we want to move those out of the employee's home department. Again, key here is matching revenues generated and expenditures. So I know it might seem tempting to set up a specific cost center or a department to track all your COVID-19 related expenditures and just put them all in that one department. However, this is not our recommendation. I think it would be more beneficial to set up sub-accounts within each of those departments that are COVID-19 specific, or separate pay codes within your payroll system to track those COVID-19 related salaries. Again, it goes back to matching your revenues and expenses in each department. However, if you do decide to set up a specific COVID-19 department, please keep track of those expenses and where those services took place outside of the general ledger system. Your cost report preparers will need to move those expenses back to the Department of Service on the cost report to match that with the revenue generated from that service. We also understand that you have incurred additional expenditures such as screening patients, visitors, employees. Before entering the building, you've added additional security outside of the building, and a lot of these things don't generate any specific patient revenue. So these expenses will most likely be included in your A&G and allocated across the rest of the cost centers via the cost report allocation. So as you can see, there's a wide range of expenses that can be captured under the relief funds. The most important thing to remember is to keep track. You want to keep track of these expenses and apply them to the various relief funds in a way so that you aren't double dipping. And I think Ashley mentioned that earlier. So our recommendation is that you not only track these expenses and apply them to certain relief funds, but also gather and retain the supporting documentations for these expenses. This slide shows another tool that we created here at Ida Bailey to help track the COVID-19 related expenditures and apply them to the various relief funds. The summary tab provides the ability to document the relief funds received by month. So we got each month here. And any specific relief fund document on this tab will carry over to this detailed tab. So you'll document each relief fund that you received and it will carry over. You'll notice there is a separate section here for the SBA PPP funds. Those are geared more towards specific payroll costs, utilities, mortgage interest, lease payments. So we have those separated out from the HHS funds. So the detailed tab provides the ability to enter the various expenditures in the tan sections here by month related that you're using to cover any of these relief funds. You do have the ability to add additional expenditures over here. There's many expenses on this list, but we couldn't include all of them. So those discussions can be had, and you think about the different expenditures that you can include in here. Oops, sorry about that. So we do suggest working with your trusted business advisors to brainstorm any additional acceptable expenses that can be included. So once you enter all your expenditures here, it'll pop back over here to that month that you entered it in underneath your whichever fund you're going to apply it to. So then here at the top, in the end, you can see the amounts received by each fund, the total expended by each fund, and then the amount you have remaining to apply to that fund. And you can also bring in your monthly lost revenue calculation to factor that in here as well.
Okay, so there's a lot of information I know that we are throwing at you, and a lot of facts and things, but I have good news. So this is the most exciting part of the presentation today. So you may have heard or seen as you were reading through the terms and conditions of the various funds, and you perhaps had, if you know people from Eide Bailly, probably bugging you about this as well, is that within the terms and conditions, it does say that for all provider relief payments that you receive, if you received at least $150,000, that you are required to submit quarterly reports to HHS and the Pandemic Response Accountability Committee. And so this guidance that came out, it said you had to submit these quarterly reports, and they were due July 10th. And so we've had a lot of questions around that of, okay, what do I need to do before July 10th, and what type of reporting? And so here's where the good comes in, is that HHS actually just clarified just on June 13th here, is that they came out and said, well, yes, this is a requirement, but providers don't need to worry about it, as HHS is actually going to develop a report that contains all of this necessary information to comply with the provisions. And so HHS is actually going to submit that quarterly report. So at this time, you do not need to worry about submitting a separate quarterly report on July 10th. So yay, that is the exciting part I can give you of all of this. That being said, of course, they always have to add in the disclaimer of, it does say specifically, again, right in that same frequently asked question, that HHS will be requiring recipients to submit future reports relating to the recipient's use of funds. So just because there's not the quarterly reporting requirement doesn't mean that you should change the thought process around needing to track all these funds, needing to show where everything was spent, because assumably at some point there is going to be some type of reporting that you need to do. So still very important, but at least maybe just gives all of us a little bit of time to catch our breath anyway, and not be worried about meeting this initial July 10th deadline with limited guidance. And so also along the lines of reporting requirements, they do specifically state, again, in the terms and conditions, that failure by a provider that received a payment from the Provider Relief Fund to comply with any term or condition can subject the provider to recoupment of some or all of the payment. So really just reiterating and going back to pretty much everything that we've been talking about so far today, is that they've really just added a lot of these stipulations in there that really it's very important to follow all these terms and conditions, because should they want to, they can really utilize those and really subject you to recoupment at any time. And so it's just really important. There's also, we'll look ahead here, there's some statutory requirements that are referenced within the terms and conditions that I think are important to take a look at and be aware of as well. And so I won't read this whole thing. This is actually an excerpt right from the federal regulations that are quoted directly within the terms and conditions. But really, it talks about how you need to maintain appropriate records and cost documentations as applicable that are documented within the financial management and the record retention and access portion of the Federal Register. And so for those of you that have been subject to had federal funding in the past or had federal single audits, some of these will be the same types of considerations that you would have seen previously, but I think just something good to keep in mind and to read through and just making sure that you're complying with those. And so again, won't go through all of these in a lot of detail, but just detailing out some of the considerations. And as Amy said, you will get the slides. But basically, some of the things that are within those regulations if you are receiving these type of federal funds. First bullet there, I think, is important to point out, where it talks about the effective control over and accountability for all funds, properties, and other assets. And so really be thinking too with these funds, we've talked a lot about the tracking side of it, but just really keep in mind, what type of internal controls is it that you have over the use of the funds? And so just be thinking through that, is there someone that is approving the expenditure as these funds are expended? Just some of those things where you can dot your I's, cross your T's, and really maintain some additional documentation there. Like I said, won't go through the rest of these in a lot of detail. I'll just let you read through those, but really just, again, important things to consider as you move forward. Double dipping, heard that word a lot today. I think it's just really important, like we cannot drive home the point enough that it is just extremely important to understand all of the sources of your funds and the uses of your funds. And I know some of these, it was very confusing because you're getting a payment this date, a payment this date, this payment this date, but just really making sure that you're understanding those individual payments, what piece of the provider relief funds they fell under, and then again, specifically keeping track of how you're using those funds to make sure that you're not doubling up and utilizing the same expenses for multiple funds. And so it does specifically, we've talked a little bit about PPP, but within the PPP Act, it does specifically, again, point out the same comment that HHS is making, in that they're also saying that you cannot use the funds to reimburse expenses or losses that have been reimbursed from other sources. So it seems like this is an important key point that is being brought up on the PPP side and HHS. I actually saw a question within, as I was scrolling through the Q&A box, someone had the question about, okay, well, what about if we are receiving other types of funding outside of PPP, like other types of grant funding? Maybe you received a FEMA grant, something like that. And the same answer applies. It's really if you have other sources that you're receiving to pay something, or if other sources are obligated to pay it. So your other grants would certainly fall into this same category as well, and would need to be tracked. So really, I think overall, the moral of the story here is just to really start beginning your plan and taking a look at all this, because there's a lot of different moving pieces, a lot of different funds out there. And so if you haven't, just really start taking a look, start figuring out, okay, what is our strategy for spending these? What is our strategy for tracking it? Because I really think it's something that, again, we don't know on the reporting right now, but a few months down the road, if there is a requirement, it would certainly be a lot of work to have to try to go back retroactively and try to recreate all of this documentation. So I think just very, very important. And to the last bullet point, protect your money. I mean, this is a sizable amount of money for a lot of organizations. And so, just really taking this opportunity to make sure that you have that adequate documentation in place, and that you're really taking steps to make sure that this money is protected and that it's not, that you don't have some that's subject to recoupment. I think that brings us to our last polling question, Amy.
All right. Excuse me, sorry. All right, polling question number 4. HHS will be requiring recipients to submit future reports relating to the recipient's use of its funds. True or false?
All right, yes, true. While we don't know what they look like, they have said that there will be some type of future reporting requirement. So again, we know it's coming. We just don't know what it looks like at this point. So more information to come. Okay, so that brings us to the end of our presentation. I see a number of, we do have a few minutes here, and I know we've received a number of questions through the Q&A, which is awesome. I'll try to hit on a few of them. If we don't get your question, Amy, I'm assuming you can save these and we can get back to them.
Yes, of course.
Perfect. Okay, awesome. I tried to take out a few as Jason was talking. I was multitasking a little bit. I did think get a few of the questions answered, but so in taking a look through here, just going to try to pull out a couple of these. Someone had asked about where you can access the documentation that the reports are no longer required by July 10th. So that is actually out on the hhs.gov website under, it's got over on my other screen here, under the Provider Relief Fund page. And then there is a section that has FAQs. And so within those frequently asked questions, there is a specific question that addresses this point. And I believe June 13th. I shouldn't say the date. I'll probably say it wrong. That'll be in your slides. But yeah, so it's out in those frequently asked questions. Just another point, if you have not already, the frequently asked questions that are out here on the HHS website provide a significant amount of detail, and there's a lot of them there, a lot of information, but I think certainly if you do have some questions and are just uncertain about things, it's nice to take a look through them. I know there's actually a lot more detail within those than there is in the actual terms and conditions. So I think very, very, very helpful from that standpoint. And then there is also a phone number out there as well, that if you have specific questions on, outside of just these general questions, if you have specific questions on, hey, I applied for subsequent funds, I haven't heard anything or any of that, HHS does have a provider relief hotline as well that is very helpful in that case. Several questions out there about the spreadsheets that we showed today. And so if that is something that you are potentially interested in and would like some assistance with the revenue and expense tracking, we would be more than happy to help. Please reach out to myself, Jason. Our contact information will be in the PowerPoint, or your Eide Bailly representative as well can help you and get you to the right place. And I think we're probably, I don't want to take everyone over time, so thanks again to everybody so much for joining in. We're happy to talk about this topic, and hopefully we're expecting things to continue changing as they have been, but we will monitor and of course continue to push out additional information to you as we have it. We have the questions, of course, that came through in the Q&A, so Amy will pull those down, and we will take a look at those and get back to you regarding those questions.
All right, well, thank you everyone for attending, and thank you to our presenters, and everyone have a great day.